Hello, everyone. Hello. Thank you for joining. We are waiting for Dr. Caesar. Yes, Dr. Caesar is here.
Hello, hi, Purva.
Hi. So I'm very happy to say that we are having a very first live session with Dr. Caesar because she is my classmate actually, and it is so happy to work together and get some good information to the people around.
Same here.
So happy that people are joining.
Thank you so much, Dr. Apurva, for inviting me to this live session. So we'll start.
Yes, firstly, I want to introduce you to Dr. Caesar. Dr. Caesar is currently working as a medical officer in John Marion's Wellness Center in Ernakulam. And she is also having now 4+ years of experience treating many people with gut health, thyroid disorders, and many other lifestyle disorders. So today we will learn something regarding thyroid. So this main session, the aim of doing this live session was to educate about thyroid. So till now I have not put anything about thyroid. People were always telling me that come up with something with thyroid, and I found Dr. Caesar, who can be best to speak about thyroid than Dr. Caesar. So we have invited Dr. Caesar to this session today. So let us speak about thyroid. Want to say anything, Dr. Caesar?
Yeah, like nowadays, a lot of people come up with thyroid. That's a good thing to educate people about what the condition is, how we can prevent it. If we can do that, that will be really great.
Yes, definitely. So whenever we speak about thyroid, like I have seen a lot of patients telling, I have thyroid. Whenever we meet someone, they say, I have thyroid, say me something what I can do. So when they are saying this, I have thyroid, what do they mean actually?
Yeah. So, like thyroid disorders can be, there are a lot of thyroid disorder. When they say they have thyroid, can be any of these. Okay, probably because of lack of education, or they really doesn't know what category they fall into. They're like saying this. So there is, when we are talking about thyroid disorders, the foremost thing should be, hypothyroid condition. Like when you have an underactive thyroid gland, when there is a very less excretion or formation of thyroid hormones, you get a condition called as hypothyroidism. So that is called as hypothyroidism. And another like condition is increased activity of your thyroid gland. So that could be named as hyperthyroidism. And another one would be, with your structure of your thyroid gland itself, you might have a lot of conditions. Like, you can have thyroiditis, where you have an inflammation to your thyroid gland. And also, you can get lumps and bumps in your thyroid gland. So that is called as nodules. You can even get, enlarged thyroid, which is called as goiter. So these are few of the thyroid disorders. And another one could be these, even these nodules can get progressed into thyroid cancers also. So these are the main thyroid disorders that can happen to your thyroid gland.
Okay. Before we continue, Mrs. Gauri is saying that make Caesar ma'am more visible. So I think you should adjust your camera. Yeah.
Now?
Yeah, it is fine. Now it is fine. So as you said, if the thyroid is hyperactive, then it is hyperthyroidism,
Yes.
and it is underactive, it is hypothyroidism. We get to know it by blood test, whatever we do.
Blood test, and also, through symptoms also you can get to know. Yeah.
So what are the symptoms to differentiate between hyper and hypothyroidism?
Yeah. So if you are taking hypothyroidism, like a thyroid gland has a lot many function to do in your body. So it acts in almost all the metabolism in your body. Like let it be carbohydrate metabolism, or your cholesterol metabolism, on your sleep, on your sexual functions. So on all these things, there is a very big impact for your thyroid gland. So when you have an underactive thyroid, all these metabolisms become slow, and you can have excess fatigue. You can have a lot of weight gain. One of the main symptoms of hypothyroid conditions could be, cold intolerance. They'll be very much intolerant to cold. A little bit cold also, they'll not be able to, tolerate. So cold intolerance is one of the major symptom. And also too much of dry skin, you can have hair fall, you can have anxiety, you can have mood swings. So these are and also constipation. Yeah, even your thyroid gland has a direct impact on your GI system also. So gastric motility, so that can be reduced in hypothyroidism, and you can get these kind of symptoms in your hypothyroid condition. And also, if you have an hyperthyroid condition, then you can have all the opposite symptoms. Like you might have unexplained weight loss, or even you might have excessive sweating, or little like heat intolerance you might have. And also you'll feel very difficult to fall asleep. So these are few conditions or symptoms when you have an hyperthyroid condition.
Okay, so basically, if hypothyroid, then there will be metabolic inactivity,
Yes.
like reduced metabolism. But in hyperthyroid, there is excess of metabolism.
Yes.
Oh.
So those are like opposites. So you'll get exact opposite symptoms in both the conditions.
Yes. So as we think that commonly only people who are obese may have thyroid, that is a completely wrong thing to say.
Yes.
They may have, it can be hypo or hyperthyroidism in any way. So when you are mentioning about symptoms, it is influencing throughout our body. So many organs and functions it is affecting. That means thyroid has a lot of functions in our body. So what are the functions of thyroid gland?
Yeah. So thyroid, as I said already, it increases all the, it has an impact on all the metabolism. So it has a direct impact on increasing the ATP or your energy production. So that is why, a hypothyroid patient will always complain about, they have excess fatigue, like they'll feel sleepy all the time. That is because of, energy production is not happening. So that is one of the function of thyroid gland. Another one would be on carbohydrate metabolism, and also on cholesterol metabolism. It has an inverse effect. Like if your thyroid hormones are proper, you can have a good control over your cholesterol levels. And then if you have an hypothyroid condition, definitely your cholesterol levels can go up high. And also on your sexual functions. If they have a normal thyroid levels, their sexual activity would be normal. And if they have hypothyroidism, definitely their sexual activity and libido will be very less. So these are few, functions of thyroid. And also on, as I said already, on gastric motility, it, if you have a hypothyroidism, you might have, constipation. Or if you are having hyperthyroidism, they might have diarrhea. So these are few functions of your thyroid. It also affects your, periods, your reproduction. All these conditions, thyroid will have an impact on.
Okay, so basically it is affecting our entire body.
Yes.
So that is why we are stressing on thyroid, that we have to manage it. And furthermore, to get more importance, why should we manage thyroid? Let us speak about the complications of thyroid disorders.
Yeah. Sometimes, when people mostly come because of, hair fall or irregular periods or excess fatigue, these are the main conditions that they say when they actually come for a treatment to a clinic for thyroid conditions. But apart from these, there are much more larger complications. Like having thyroid disorders for a larger period of time can even have, impact on your heart health. Like if you have a hyperthyroidism condition, your heart can be excited. Because of hyperexcitability of your heart, you can even have heart failure and all. And other way, if you are turning around to hypothyroidism condition, because of the excess cholesterol production, you can have atherosclerosis. And because of that also, you can have blockage, and then you can have heart related issues. So this is one condition. Another one would be, many of them doesn't even know, probably they won't even know if they have some lumps or bumps in their thyroid, because they always check only, T3, T4, TSH levels. Okay, that is fine. And then, yeah, finally, they come to an impact that their hormones are working well. They don't have any issues with their thyroid. But nobody goes for a scanning, next level scanning, thyroid scan, Only in scan we can understand if we have lumps or bumps or nodules, or if you have a goiter or anything of that sort. So detecting that is also very important, because another complication of thyroid is again thyroid cancer. Your nodules can get worsened or progress, and then finally it can become to a cancerous condition. So these two are two of the major complications. Apart from that, it can also have lots of effects on your reproductive capacity. It can even lead to infertility. It can, but then again it can be managed if you're well managing it in the earlier stage itself. So these are the few of the complications.
Educating ourselves with the complication is very important. It's not just to scare ourselves, but to know that if we neglect and don't take care of it, then it
Yes.
can lead to very major complications. And as you said, it affects the heart majorly. I
Yes.
recall one of my case where there was an unexplained increased blood pressure. So
Okay.
they didn't have any symptoms at all. But once there was a lot of checkups and then concluded to be a thyroid disorder.
Yeah.
So that's how it affects the heart.
Yes.
And we don't know also, like symptoms are not very early when it is in a like complications
So
stage.
that's what I was telling. Like when we are taking thyroid disorders, probably people would only be seeing to the thyroid function only, like T3, T4, TSH is proper. They might take a scan also. In that, few of the things get detected. But then there is another condition called as Hashimoto's thyroiditis, where your body itself is attacking your thyroid gland. So if we need to know that, we need to again get checked, or we need to do specific tests for that. So that mostly people are not that much educated. That's what I feel on that part. Probably most of them doesn't really know about that condition. Like it's an autoimmune condition. Even your body itself can attack your thyroid gland. So even that we need to have a check on.
So basically, when we are facing some symptoms, it is important to go to a doctor and get a test. Then it's not just take blood test by yourself and conclude that I don't have any thyroid issues and just be quiet. So it may have some other underlying causes, and it is always better not to take conclusions by own or from Google.
Correct.
People are Googling everything, whatever symptoms they have, and it just tells something else.
Right. Yeah.
Speaking about complications, now let us speak about can we prevent thyroid disorders, or how to prevent it.
So if it is a genetic condition, definitely you can't. Like if somebody is born with an underactive thyroid, then we can't prevent it. But then, see, if I have thyroid, my children are definitely prone to have some or the other thyroid related condition. So I can, to an extent, I can prevent that if you are giving, proper nutrition. And if you are taking care of all the, factors that will affect your thyroid gland, like by decreasing the stress level or giving a proper nutrition. So if you're doing all those, you can definitely prevent having thyroid disorders to an extent.
So someone asking home remedies for thyroid disorder. Surely we are going to say it is not just home remedies. It is scientifically proven things which we are going to suggest during our further discussion. As we said, it is completely we can prevent if it is not genetic, and definitely we can manage it. So whenever we talk about management, the first topic is food. So what do I eat to cure this disease? So what is the things they should follow?
So mostly, there are many conditions where just because of nutritional deficiency, you can get thyroid disorders. Like, your proper thyroid functions, like thyroid hormones to be produced. You need, T3, T4 conversion for all those. You need iron, there are specific nutrients that are required for the production of proper amount of active thyroid hormones. So that will be, iron and, iodine. Iodine is a very important factor, and also zinc and selenium. These are few of the important micronutrients that are required for your body to produce proper amount of thyroid hormones. So including all these in your diet is a very important part to prevent or to manage your thyroid, gland.
Yes. So when we speak about iron, like what are the foods they can take?
Yeah. So they can take seaweed. Seaweed is a good, thing to take for iodine. Otherwise, nowadays we don't really have to take iodine-based products because it's already enriched in our salt. Salt, like table salt, already contains iodine. So go for iodized salts. If possible, you can go for that. Otherwise, you can go for seafoods have lots of iodine in it, and also seaweeds have lot of iodine. So you can take any of these for iodine.
Yes, if we are eating iodine rich foods, then it's okay to use some other type of salt.
Yeah.
But if we are not in coastal region, it
Yeah.
is always preferred to have iodized
Yes.
salt, is it?
And also nowadays we do get lots of supplements, like iodine supplements. So if you want, you can go for that also if you are really deficient or if you have, some kind of thyroid condition, but only under the supervision of a healthcare provider. So definitely consult a physician and then go for, if at all you are taking supplements, go for, consultation and then take it. That will be better.
Okay. So they're asking what about pink salt and black salt. So as we suggest, it is like pink salt and black salt you can have in some of the dishes when there is particular you need it. But other than that, it is better to have a iodized salt.
Yeah.
It is fortified salt.
When thyroid conditions, definitely it's better if you take,
Yes.
salt.
To prevent the thyroid disorders only, government has fortified into our
Yes.
food, because if you are living in a coastal region, you tend to get that iodine, but
Right.
otherwise you don't. So it is better. And the pink salt and black salt considered, they have very less amount of nutrients,
Yes.
that only by eating salt you can't get those nutrients anyway. So there
Exactly.
is doesn't make sense that completely shifting towards pink salt or something like that.
Correct. If you, it'll be always better if you are taking iodized salt if you want to prevent, thyroid conditions.
Yes, yes. Yes, exactly. Then, other than that, as we said, that iron-rich foods and selenium-rich foods,
Yeah.
these are the things. So,
Yeah.
what are the specific food items they
Yeah.
can?
To increase your iron intake, you can go for beetroot or like pomegranate, spinach. All these are good sources of iron. So you can go for these ones. And if you need to take, zinc and selenium, your Brazil nut is a very good source of selenium. So 1 or 2 Brazil nut will give you proper quantity of selenium for a day. So you can take 2 Brazil nuts per day. And also, nuts like walnuts and macadamia nuts. All these nuts are very good source of zinc, selenium and zinc. So you can go for those. You can include those on your diet to prevent thyroid disorders.
Okay. So, what is the any specific food which we have to avoid?
Yeah. So there is a misconcept that you need to avoid all the cruciferous vegetables. So that is actually not true. So nowadays, when we are seeing the researchers and all, actually only if we are taking it as a raw food item, then and only then these cruciferous vegetables will hinder the thyroid functions, because the only part which will hinder the thyroid function would be iodine uptake. Okay, so there was a study where they have taken morning and evening for 7 days. They have taken kale juice. Okay, so for 1 week they have taken that, and then only 25% of iodine uptake was hindered. Okay, but again in that study it was shown that your TSH levels were proper. There was no that much variation in your T3 T4 TSH levels. Only 25% reduction in your iodine uptake was found in that study. So it's not mandatory that everyone who has thyroid condition should and definitely avoid all these cruciferous vegetables. And also it is only that particle or the nutrient called as thiocyanate that has a impact on your thyroid gland. But if you're heating it, definitely you can decrease the harmful effect of the thiocyanate present in the all the cruciferous vegetables.
Okay.
So he
Actually, we can
yeah.
have all this cabbage, cauliflower, and all of these. Like people think that we should completely avoid, not touch it. It's not like that.
No,
But
nothing like that. They can have it in limited quantity. So
yes, it's
yeah,
always better having a
yeah.
cooked one instead of having it in like lettuce, salads and all they have. It is
Yes.
better to avoid and have it like a sabji.
Cooked form, yeah,
Yeah.
correct. That will be a better option.
Okay. And another thing is commonly people consume the soap, coriander seeds. Is it helpful for thyroid disorders?
Yeah, that is also to an extent it is helpful. So they can take that also. Coriander seeds also help in functioning of proper functioning of your thyroid gland. They can take it, but there is no one remedy for your taking some drink or that will definitely enhance all the metabolism. But you need to find out what is the root cause, whether you do you have any autoimmune condition, or do you have any nutritional deficiencies, why are you getting these condition, and then curing that or then targeting on that would be a better idea than consuming all these things.
Any food item, if we want to include in our diet, it is better to know why are we adding that food into our diet. Like, do we have deficiencies or that nutrient is required? Just lame remedies by all the social media, it is not required to add into your diet. And ultimately, it is food. It is not some miracle or magical thing that suddenly you take that drink and everything will be fine. It's not going to be like that. So other than these things, like to avoid, many people say that we should avoid dairy, gluten, and all of these things. So what is the take on that?
So that again, your wheat and milk, lactose and gluten, basically, these two things will increase all the inflammations, and also, it can hinder your gut health. So that is one of the major reason why we always say that it's always better to avoid. If at all you have some thyroid condition, it's always better to avoid lactose and gluten, because it will hinder your gut health. And also, from your gut only, all whatever nutrients that you're giving, if it should be properly absorbed. See, as I already said, nutritional deficiencies can cause hypothyroidism or thyroid disorders. So if at all your gut is impaired, gut health is impaired, definitely you'll have a lesser amount of absorption, and then that can again cause into thyroid disorders. So that is one of the major reason why we are saying we need to avoid wheat and gluten. I mean, lactose.
Yeah, lactose. So gluten and lactose are the major components in that products which are causing like inflammatory conditions to. So that is how we should avoid. And apart from the food aspect, is there anything else to manage our thyroid disorder?
Yeah. So another thing would be, stress levels. Your cortisol can again hinder the production of thyroid hormones. So cortisol is excessively created or, excreted because of excess stress. If you are stressing out, definitely your cortisol levels will be high. And that can again hinder the production of thyroid hormones, and then thereby causing thyroid disorders. So definitely you need to manage stress. If at all you are having thyroid conditions, you need to manage stress to an like proper level, so that you can manage your thyroid dysfunctions.
Uh, when we speak about managing, what role has exercise on thyroid disorder?
Yeah. So there was a study which showed, proper cardio or aerobic exercises, decreased or managed or increased the levels of active T3 and T4. So, exercising is a really good option if you have thyroid related issues.
Yes.
Like, especially
So if someone
aerobic.
is physically inactive and you have thyroid disorders or you want to prevent, so exercising should be the must. So they
Yes.
have to exercise. And anything specific in exercise should they do?
Yeah, so that's what I said. Like cardios are really good. They can also, go for strength training or weight training is also a good part. Cardio is really good, as we have seen in a few researchers. So you can go for some cardio, treadmill, like walking, running, skipping. So these things are really good.
Yes. And apart from that, I want to add like including these exercises, they can practice yoga because it will also help in management of this stress
Yes.
level and
Yes.
also
So yoga is a good option if they have thyroid issues. like specific yogas like Sarvangasana or Ushtrasana, that will again help in, those are specific asanas for your thyroid functioning. So you can go for those asanas. And also in naturopathy, we do have another treatment called as throat pact. So that is again another very good option if you have thyroid disorders, to manage your to activate your thyroid gland. It's a really good option. So it's a really simple procedure. Like you should just have one towel with you and some cold water. You can just dip the towel in the cold water, and then you can place it over your neck for 15 to 20 minutes. So that will again enhance all the functions of your thyroid and help to manage your thyroid disorders.
Yes. So these are very easy things which they can do every day at home.
Yes.
So can be done. They're asking specific asanas for this. As she mentioned, it is Sarvangasana, Ushtrasana. As
Yeah.
you asked before, like you can also do neck exercises. That is also quite good. Basically, not only this, you have to add cardio. As she said, cardio has been proven. So
Yeah.
what people are like, when they are practicing yoga, they suddenly feel that they are superior and people who are going to gym are not good. So that doesn't work like that.
That is,
You should do all the exercise,
yes.
like your
And the
exercise
whole
should
kind
have.
of work, yeah, definitely will help you. But then, yeah, yoga is also, as you already said, to reduce your cortisol level. All the relaxation techniques like, IRT, DRT, instant relaxation techniques, deep relaxation techniques, those has a really good impact on reducing your cortisol levels also. So you can go for that. So yoga is also fine. You can go for any kind of exercises, whatever possible, or you can mix all these. You can start with some aerobic exercises or some cardio, and then you can go for some yogasanas, and then you can finish it off with some relaxation technique. So that can be a really good thing to manage your thyroid dysfunctions.
Yes, exactly. So the second asana is Ushtrasana, that is backward bend. That is what we mentioned. And other than that, like as we discussed, all of the exercises are very good for managing thyroid. So you can include all of these in a week. You can do one day yoga, another day gym or cardio, and modulate yourself. Basically, you should reduce your stress levels and get physically active. You can choose anything you want. So any other specific questions, if there, please ask so that we will conclude with few of more questions. Anyone who is there online, if you have any questions regarding thyroid or your personal conditions, you can ask them. So we'll move on with our discussion. So there are some common assumptions regarding thyroidism, like how once we start medicines, we can never go off medications, and it was a lifelong process. So is it true?
We can't say that, because we can definitely decrease the dosage, but only if you are finding the root cause, what is causing the gland to be underactive. So as I already said, like whether it's an Hashimoto's thyroiditis, if it is an autoimmune condition, definitely we need to take care in that part. Otherwise, if it's a nutritional deficiency, you need to take care of that part. If you are doing that, definitely gradually you can reduce the dosage and then you can stop it. But if it's very late, you are having like thyroid since like some 10 or 20 years, it's not that easy. Like if you're changing the lifestyle also, definitely it will take some time. But then yeah, to an extent we can reduce the dosage, and then we can like stop the medications also. But if it is found on a very early stage, we can definitely stop the medications, or medications as such. The active thyroid hormone that is given, we can definitely reduce it, or we can even manage it otherwise also, just with adding a proper diet and changing your lifestyle itself, we can correct it.
Yes. Until unless they get the reports done, like with blindly just following home remedies and thinking if it is
Yeah.
thyroid get cured, that shouldn't be done.
That should never be done, because as I already said, thyroid is an important, very important gland that has a lot of functions in your body. So if you're not taking, if at all your thyroid gland is very underactive, you need to take the thyroid hormones for until and unless your thyroid gland is properly active, you need to at least have that support. Otherwise, definitely you might have lots of complications later on. So it's better to go hand in hand with medications and lifestyle changes. And once your gland is properly active, then you can cut down the dosages.
Yes, that is very important, because some of them who are following sattvic lifestyle or organic or whatever we can call it as, they are very adamant saying that medicines are very bad for you and we are not going to take. We are just we want to do only through the diet. That is not possible, and it is not a good way to deal.
Sometimes that's not possible. When it's in very early age, that can be possible, but not always. So definitely go and meet a doctor, consult your health professional, and only with the advice, then you can go for further, changing in your lifestyle or all these things.
Yes, it may be in any disorders. I see commonly with diabetic patients also, the blood sugars will be very high, but they will be adamant that no, only through diet and exercise I want to correct it. You definitely you can correct it, but give it some time so that body will respond well. And
exactly.
yes, and the another thing is most of the women think that if we have hypothyroidism, we cannot get pregnant. And how is it?
No, nothing that sort. You can get pregnant with hypothyroidism, but only when it's managed properly. As I said already, either through medications or through dietary management or through lifestyle management. If you're managing it well, if you're keeping your TSH, T3, T4 levels proper, and if you don't have any kind of autoimmune conditions, all those things are managed, then you can definitely have kids with hypothyroidism or hyperthyroidism conditions also.
And only like we have to manage it properly. Then we can definitely have normal functions. It is not only like getting pregnant, even all other complications you can prevent, and it will help you with that. So another thing is they think that only obese people will get the thyroid issues. So what is the truth?
Of that sort also, like that is one of the excuse that we usually get in clinics. Like if they are obese, they always blame it on to thyroid. It's not just thyroid itself, but even whatever you're taking, the calorie intake, everything matters. So definitely having a proper diet and lifestyle matters more. Like, and not only obese people can have thyroid issues. As I already said, in hyperthyroidism, you might be you can lose excess amount of weight, and that is again another thyroid disorder itself. So it's not
they had asked one question previously, like what is like obese people, obesity and thyroid. So that is what, only if you are overweight, then you have to concentrate on reducing weight. It's just because you have thyroid, even if you are normal weight, you need not reduce your body weight.
You need not really lose weight, but go for a balanced diet, or go for a proper exercise and diet or lifestyle can help you with your thyroid disorders.
Once you start concentrating on your lifestyle correction, definitely if you have excess body weight, then it will automatically get corrected, and it is fine. Even there is a question like how frequently can one go for thyroid test?
Yeah. So that again depends upon your T3, T4, TSH levels. If you have normal, T3, T4, TSH and your antibodies, everything is normal, you can go for, yearly once, you can go for a test. Not just blood test, you can also go for a scanning. Ultrasound scanning you can take, so that you'll come to know if at all you have some, thyroid nodules, or if at all you have a condition called as thyroiditis. So these things can be known if you take a USG test. So this you can do at least yearly once. If at all you are a hypothyroid, patient, then you can at least monitor it, monthly once. If at all you have elevated TSH levels, then you can go for 2 weeks once. You can just get your T3, T4, TSH levels tested, just to know how well your active T3 is, or your T4 production is happening, or your TSH level, how it is managed. So so this way you can go for testing,
like how this treatment is working on you, then so it is better.
Yes, correct. Exactly.
Yeah, that's what it said, that once medication starts, we have take lifelong.
Right.
Yeah, we already spoke about it, telling that it is not like that. Only if it is severe condition, then it will take time for you to reduce dosage of medications. That is how. And in spite of correcting your lifestyle and diet, if your thyroid levels are not getting low, then definitely you need to carry that medications for lifelong. But usually, as we see in many patients, once they start practicing a healthy lifestyle and follow our advice about diet and everything properly, then definitely we have seen reduction in dosage of medications, but it will take time. And the problem is with people is when they have this thyroid disorders, they don't go to a doctor. Only when the symptoms are very worse, like when they are having irregularity in periods for a very long time, like yearly once or twice they are getting, then that is when they go to a doctor.
Yeah.
But how important it is to get early detection.
So that's what, like, along with thyroid, you might also have other complications, like not just thyroid, as I already said, it affects a lot of your metabolism. You might have other factors as well. So you need to, have an expert advice to, include what all you need to include, or what exercise you need to do. Or, you might also have to do some other tests which are not really shown in, a normal Google search. Sometimes, we'll have to do this free T3 or free T4 test to know, how much is the active level of active thyroid hormone that is produced. So so for all those expert guidance, definitely you need to go to a healthcare provider or your doctor, and then he or she can guide you properly, like what tests to do, or what diet or supplement, or on what medications you have to be put on.
Okay, there is another question telling that if we are taking any complementary treatments, how long should we continue with the supplements?
Yeah. So usually in thyroid conditions, what we see is they give a combination of probably zinc, selenium, iodine, ashwagandha. So these supplements are mainly given for thyroid conditions. If there is an underactive thyroid, definitely these are the ones that is given. So this can be taken minimum for 3 months, and then can be rechecked how far your thyroid gland has improved, or your thyroid function has improved. And if it is improved, or if it's okay, then you can gradually stop it. There is no requirement for it to continue for your lifelong. You need to continue or anything of that sort. You can at least take it for minimum of 3 months, and then accordingly, like after seeing your T3 T4 TSH levels, or monitoring your whatever thyroid ultrasound, or how far you have got the improvement, that way we can decrease the dosage, and we can even stop the supplements.
Yes, like if you are taking a iodine supplement because you are too much deficient, and gradually you can shift to iodine in your food, or somehow like that you can manage it.
So once you're stopping the supplements, you can go for dietary, intake of all those whatever nutrients that are required.
Why that supplement has been advised, that to know that it is very important. So gradually we can reduce that and shift to some other easier method which we are getting to. And anything else you have questions, like is anyone there with some questions? Okay, so we had a good amount of discussion on thyroid disorders. So the takeaway message is, if you are having thyroid disorders, just go for regular follow-ups with your doctor. Don't follow anything and everything which you see on social media. Like even me and Dr. Caesar both are active on social media, giving out some good amount of content, and which is scientifically, which has been proven, and not just lame things. So try to adapt and follow people like that. It's not like only we both are doing that. There are many out there who are giving genuine information. You can just follow them and get information from the right source. But still, whatever you see from video, just by seeing our videos also, you can't take a conclusion. Definitely you need to visit your doctor. That is what is important.
So yeah, we had a really good discussion. I think we can even create a series, like thyroid series or anything, how to manage it.
Yes,
How
definitely. If you have any of those people who are watching this, if you are having any queries regarding thyroid disorders, so you can put up those questions, DM us, so that we next series will come up with those questions and we'll answer those things. So just take a overall message that you can prevent definitely. You can prevent thyroid disorders. You can manage it with lifestyle corrections. Just follow a proper guidance, and major key is following a healthy lifestyle for any disorders taken, specifically when we are talking about lifestyle disorders. Okay, then, if all the questions have been done, thank you so much everyone for joining us today. And we had a very good session with Dr. Caesar. It was very informative. So if you all agree with it, please give a thumbs up in the comment section.
Doubts or queries, you can always, ask us through messages or, comments.
Yes, sure, sure. Anytime you can reach out to us. We will try to give these informations to you as much as early we can in a good presentable manner, and we'll try to come up with a series, not only with thyroid disorders, with any other disorders, whichever you have.
Also, comment if at all you have any suggestions for our next videos or any live sessions if you want.
Thank you so much for your wonderful comments, and please let others also get right information. So spread the word. We are trying to educate. That is the only reason why we are on social media, just to educate the right things to people. We are not getting anything out of it basically, but the thing is to give right education to people. And if you people have to other people, then it will be fine.
We need more time still. Short session. Okay. So next time we'll definitely have a longer session. You can all, add your questions and your, if at all you have any doubts, you can comment it down on our videos. We'll be definitely putting out another live session soon.
Definitely. There is a lot of information regarding any disease which we take. So we cannot put everything. We need to know that what audience wants and what are they really understanding. We can keep going on talking for 2 hours or so, but if it is no use if you people are not understanding and you are not with us. So if you have any questions, feel free to ask us. We'll definitely come up with another session. Okay, then see you all soon. Bye. Thank you, Dr. Caesar, so much for joining us.
Dr. Apurva. We had a really good session. And thank you all for joining. And yeah, we'll see you soon.
Yes. Thank you. Thank you, everyone.